Hi, I'm Dr. Ryan Cobb. I'm Assistant Professor of Clinical Radiology at the University of Pennsylvania. I'm an interventional radiologist. I specialize in complex chronic venous disease as well as vascular anomalies. And currently, my practice is about 70% complex venous reconstruction, predominantly dealing with patients that have already had stents placed and are suffering from chronic venous disease. So the majority of my practice is managing and dealing with severe post-thrombotic syndrome as well as chronic DVT. Being at a large university and academic center, I focus a lot of my practice on treating these patients longitudinally, so not only just in the lab itself, but also following them up over the course of their chronic disease state. In particularly, what we're looking at Penn is ways to recannulate as well as do thrombectomy for chronic DVT within stents. So I've been working a lot and very closely with some device companies on creating novel ways to deal with what's becoming sort of my generation's IVC filter, where a lot of stents are being placed, whether or not they're indicated or not, and placed sometimes inappropriately. And then dealing with the ramifications of that, especially in younger patients in their 20s and 30s. So it's one of those disease processes that I think is underserved and misunderstood, if you will, that needs a lot of growth, especially in the technology world, because we're using, up until the past couple of years, we've been using devices that were basically developed 20, 30 years ago and just weren't cutting it. So there's a lot of opportunity of growth and a lot of new innovation that should be on the horizon soon.